Welcome to NorthBay Healthcare's Doc Talk Live. We're so glad that you could join us today. A few logistics. First, if you have any questions during the talk, you'll see there's a chat box. Just send your questions via chat, and Karen will answer those at the end of the presentation, and she'll try to answer just as many as she can. Now, let's introduce Karen. Karen Vikstrom, she's our guest speaker today. She's a genetic counselor, and she knows that genes can affect our health. Not the tight-fitting ones or the fated pair, but the ones you are born with. In this talk, Karen is going to focus on answering one of the most common questions she receives as a genetic counselor at the NorthBay Cancer Center. How do you know if you need genetic testing? The answer to this is complicated, but Karen is also going to demonstrate a new screening tool she uses at NorthBay Cancer Center that will help people answer that question for themselves. Using a real example, Karen will explain how you can use information about your genes to stay healthy. Outside of work, Karen's a mother of 4, which pretty much fills her free time. But when she's lucky enough to have free time, you'll find her on her family's farm, happily tending to the berries and trees. Please help me welcome Karen Vikstrom. Karen, if you would start off by telling us the purpose of this talk.
For the purposes of this talk, I am going to draw a family tree, and this is based on a real patient, but I've changed the name, of course, and some of the identifying factors to keep her privacy. But this is a typical genetic counseling session. Sarah was referred to me because she's being evaluated for breast cancer after a mammogram finding, and our breast surgeon, Dr. Marengo, noted that she has a family history of cancer. So she came to me, and the first thing that I do is draw a family tree. What I'm looking for essentially is a pattern of cancers in the family that might hint that there could be a gene running in the family that might explain the cancer. So what I learned from Sarah is that she's 62. She has a generally healthy lifestyle with no known risk factors. She is married. And by the way, the circles in the pedigree represent females and the squares represent males. The arrow just means that I'm talking to Sarah that day. She's the proband. Sarah, as you can see, has 2 adult daughters and 1 sister. And I learned that her father died of prostate cancer, metastatic prostate cancer, at the age of 68. And this was about 20 years ago, so he would not have been offered any testing back then. But drawing out one more generation, I learned that her paternal grandfather died of pancreatic cancer. So those are the only known cancers in Sarah's family history. If you guessed that Sarah may have a gene running in her family that would explain these cancers, then you are correct. It is the case that pancreatic and prostate cancer are part of the BRCA2 spectrum of cancers, and you'll probably recall BRCA2 is associated with hereditary breast and ovarian cancer syndrome. And this is confusing for a lot of people because when a woman develops breast cancer, for instance, when she thinks about her family history, she often thinks really only about, are there other women in the family with breast cancer? Are there other women in the family with other female type of cancers like ovarian? But it's not common for people to think that maybe a prostate cancer or a pancreatic cancer is related. But hereditary breast and ovarian cancer syndrome, unfortunately, it was named when researchers back in the mid-90s were only tracking those 2 types of cancers. We now know that BRCA1 and BRCA2, which cause hereditary breast and ovarian cancer syndrome, can cause an increased risk of prostate cancer in men and an increased risk of pancreatic cancer. So when we see a family history of any combination of those cancers, it's important to evaluate for hereditary breast and ovarian cancer syndrome. I suspect that name is going to change in the coming years, and it will probably be named to something like BRCA-related cancers. But for now, it's important to evaluate for all types of cancers in the family history. I'm going to switch gears again for a second and talk about a study that was published last year. And this study involved testing 100,000 people with cancer to see what percentage of patients tested positive for any of the genes that they were testing for on the panel of genes. Usually, by panel of genes, I mean they're testing for dozens of genes at once. And the numbers were surprising because we learned through studies like this and others that ovarian cancer, for instance, has a hereditary cause in approximately 18% of women diagnosed with ovarian cancer. Pancreatic cancer and prostate cancer is also more than we expected. And this sort of information is now starting to be much better understood because so many more people are getting tested nowadays, and we're starting to see that the spectrum of cancers that we associate with specific genes is wider than we knew, and hereditary causes are probably more common. Wanted to bring this up because other research has shown that a lot of people are being missed. People with hereditary cancer syndromes are being missed because we are not identifying people appropriately. People who should have genetic testing but are never offered genetic testing because we have not identified them as good candidates for genetic testing. Back to the question, how do we identify people who should be offered genetic testing? Or to answer the question from a patient's point of view, how do I know if I need genetic testing? The NCCN Guidelines are widely used as a reference for knowing when to offer germline genetic testing, hereditary cancer testing, to people for many different types of cancer, including breast, colon, ovarian, prostate, pancreatic. There's a different set of guidelines really for each type of cancer. The problem is these guidelines are really complicated. They're changed. They change frequently, sometimes updated on a yearly basis. So it's hard for clinicians outside of my field to keep up with these. Because of that, we're using a new tool at NorthBay, which I'm really excited to try out. It's a tool that combines the process of collecting a family history and applying the NCCN guidelines to that family history to see if a patient screens positive, meaning should that patient take the next step and ask to get a referral for genetic counseling or talk to their doctor about getting genetic testing. And I'm going to demo this tool using Sarah's pedigree to show you how it works. Okay, so I've navigated over to northbay.genomesmart.com, and you can use your any browser in a phone or a laptop. This program will work in with any type of device, and I've filled in all of this information to get things started. And we are going to use Sarah's family as a test run. Okay, it asks about ethnicity, and she's a female. All right, so when you enter the program for the first time, you'll see a lot of little cards that educate you as to the purpose, but I'm going to skip through that for now. And I wanted to draw your attention to Genome Learn, which contains articles that are really well-written articles by some of my genetic counseling colleagues at the company that created this AI tool. But we won't go through that now, but I just wanted to let you know they're there. And now we're going to start the hereditary cancer assessment. So do you have a personal history of cancer or non-cancerous tumors or polyps? In Sarah's case, the answer is yes. She had breast cancer, and I'm going to go through this quickly, but just you'll get an idea of how the tool is used and the questions that are asked. It's quite comprehensive. Do you have family history information on at least some of your close relatives, and in her case, the answer is yes. And it asks, do you have a family history of cancer or same question, but it applies to the family. So let's say yes. And she has a father with prostate cancer and pancreatic cancer. That's on the same side of the family. Now they're asking specific questions about her breast cancer. I'm going to say no. No, and don't worry if you don't know the answers to these questions as you're going through it. Just say no. The tool is designed to work with limited information. And no genetic testing has been done. So preview summary. This brings you to a page where you can review your answers, and if you learn that something needs to change, you can always go back and change it. Now you get to go to the report, and you'll see here an email was sent to you so you can read this report as a PDF file. And what this result says is genetic testing may help you better understand your risk for developing cancer. This is a screen positive, and if you scroll down, you'll see which NCCN guidelines Sarah meets for germline genetic testing. She actually meets 2 sets of guidelines for both pancreatic and breast. And that is it for the patient side of things. On the clinician side, what I will see for someone who screens positive is the reason that they screen positive based on their family history. And I will also see which genes or conditions are under consideration. And scrolling down, you'll learn more about how to set up an appointment, or you can print this document and share it with your primary care provider and discuss your cancer history. Before using the tool, I would recommend that you talk to a family member and find out as much as you can about your family history. For every person in the family diagnosed with cancer, find out what type, the age they were first diagnosed, and if any genetic testing was done. Let's get back to Sarah for a minute. You now know that she met testing guidelines for hereditary breast and ovarian cancer, and we did end up testing her with a comprehensive panel which included 34 genes, and she tested positive for the BRCA2 gene. As you can imagine, Sarah was scared and a little overwhelmed at first to learn that she has the BRCA2 variant that likely caused her breast cancer and the cancers running in her family. It was really important for her to learn that she is not alone in this diagnosis, and there are in fact many women and many families out there who have been diagnosed with a hereditary cancer condition. And I'm showing you a website called Facing Our Risk of Cancer Empowered. In addition to summarizing the risk management guidelines published by the NCCN, this website has a wealth of information on a variety of topics, broken down by subjects that are really important for people like Sarah to understand and consider before she makes her healthcare decisions. Sarah was also very interested in learning what steps her daughters and her sister can take to reduce their risk of getting breast cancer. So we reviewed the risk management guidelines on the Force website, and these apply to individuals who inherit the BRCA variant running in their family. And we won't go over these in detail now, but you can see that screening for breast cancer kicks in at a pretty early age in the 20s or 30s, and all of these guidelines would apply to any individual in Sarah's family who tests positive for the BRCA2 variant. I mentioned earlier that we did comprehensive genetic testing on Sarah, and the slide you're seeing now is a list of the genes that we tested. This is a standard test to do nowadays. It really covers all the bases in the sense that no matter what kind of family history you have, most of the important genes are on this list. I wanted to mention too that for those of you who find out that you do not meet testing criteria, that you do not meet any of the NCCN guidelines, it is still possible to get tested if you're interested, and that can be particularly important for someone who doesn't know their family history. I just mentioned that now because, as I said, the cost of testing is $250. That's out-of-pocket cash pay, not needing to go through insurance. So it's an affordable option for people who may not meet testing criteria but are still interested in getting tested. So that brings me to the end. If you have any questions, ask away. And the URL on this slide is how you can find the risk assessment tool and use the access code April 2020 for 3 months. And let me know if you have any questions. Thank you for listening.